All right, we're live. It's Dr. E with EmmanuelTherapist.com and EdgeRehabandSport.com, and I'm here with my good friend Adam Kelly of EatRunRehab.com. So you may know us from social media, or you may not know us at all if you just happen to randomly click on this Hang On Air. So Adam contacted me regarding a neck injury from Brazilian Jiu-Jitsu. So give us your history, buddy.
So I don't have too much of a major history for any neck injuries, but starting last Wednesday, whatever date that was, I was in class doing jiu-jitsu, and it was my third day in a row of doing jiu-jitsu, and I probably was at my second class in like 12 hours. You know, there's 12 hours difference between the two. Like I had gone the night before, and then I was at the noon one the next day. And there was no traumatic event that happened to me. I just know that all of a sudden I was grappling with a guy, and then all of a sudden I'm like, oh, my neck just spasmed and locked up. And then I still had a little bit of motion, but I knew it was pretty bad. You know, I knew that it was going to be bad. And by the time I got done driving my moped back to my apartment, I couldn't move my neck at all. I had, like, you know, just straight ahead motion, and that was it. And so I didn't do too much for it. You know, just had my girlfriend. I do some, you know, IASTM, and I did a couple of chin tucks and stuff, and may have used a couple of drugs to help out, but, you know, I just kind of ignored it, but I'm like, oh, it's going to be fine. And then I tried to go back this past Monday, today's Friday, and same thing happened again, and I was, like, done. You know, it was worse than the time before. It was affecting me so much that I couldn't sleep at night. And I had zero side flexion to the left. I had zero rotation to the left. And I couldn't bring my chin to my chest anymore. I had zero cervical flexion. And I had pain.
You cut out after the second, after going back on Friday. What exactly happened? Because all of a sudden you cut out for maybe like 5 seconds, and then all of a sudden I started hearing treatments and range of motion.
I went back on Friday?
Yeah, you went back on Friday, then you cut out. So I don't know what happened in between that part of the story and the loss of range of motion.
Sorry, I went back on Monday, this past Monday. So today's Friday, so just, you know, 5 days ago.
Right. Yeah.
And, you know, I did the warm-ups, and I did good takedowns, could do everything fine. And then I got into a position called butterfly guard, which is like, you know, I'm sitting on my butt, and I go to put my chest, like my forehead, into the guy's chest to keep my distance away from him. And then as soon as I put my head on his chest, it's not like I slammed my head on his chest, it re-spasmed, did the same thing as the week before. And then I lost, like, all cervical range of motion after that.
Just to the left or in all planes?
I don't have cervical flexion, but then to the left I lost most of everything. But then I had a lot of extension. Well, for me, I had most of my extension. I'm always lacking some extension. But I had most of my extension, but it was still painful at the end range. But then the other weird thing that was, like, happening was that if, like, I'm laying in bed at night trying to sleep, if I go to, like, put weight on my left arm to roll to my left side, it would cause, like, severe pain at, like, T4 off to the left side of my scapula. Or left side of my spine, but near my left scapula. Uh-oh. Now you cut out. All right, I think you're back.
Oh, I'm sorry. I said your pain drawings on the intake forms, everything you feel is on the left, correct?
Yes.
Okay. And where do you feel it?
I would say between, like, T4 and T8, and then also, like, you know, right at the cervical thoracic junction. You know,
Okay.
T1, T7.
And also, you said that ISTM makes it better, PNF makes it better, but you can't get it to lock, right?
Yeah.
You can't get it to stay?
Yeah, and I can't get any, like, good side bending. I feel like if I could go and do some actual side bending to the left, I would actually be able to reduce a lot of symptoms and get a lot of range of motion back. Oh man, are we locking up again?
Yeah, yeah. Um, my connection is strong. Is your connection strong?
It is, but I can try to go to a different room. Want me to do that? We don't have to disconnect.
Uh, yeah. Oh, why? Are you hardwired?
No, I said we don't have to disconnect. I'll just carry my laptop to another room.
Okay, yeah. I'm going to try and switch to SD if I can.
I mean, so far right now, it sounds good. I don't know why it would just hiccup like that. Probably Comcast, right?
Yeah, yeah. You're getting throttled, man. Your
Uh,
bandwidth throttled. Okay, I switched it to no enhancements and to SD, and now you can't.
did it again.
How will people know who I am? Now they will.
There we go.
Yeah.
I can hear you now.
Okay, okay. Um, alrighty. Um, so yeah, I mean, one of the reasons why you probably aren't able to reset is you can't get anywhere near end range.
No, not even close.
So you're limited by pain, or it just doesn't go.
I mean, I would say both, but it just feels like it doesn't go. Like if I try to go, it's not that painful, but this is all I go.
Yeah, yeah. Okay. And your pain is intermittent?
Yeah, only with motion, with those active motions.
Okay.
It's not. If I just sit here, nothing. It's good.
Any other complaints?
Just that weird, if I'm laying flat and I try to extend my shoulder to put weight onto it, or bear weight, so I can roll over to the left, then it's like everything spasms as a result of that.
Okay. I often think about why people have difficulty lying down in what is normally a very non-threatening and relaxing position. And it's an often stated complaint when people say they have left neck or shoulder pain and they can't lie on the left. It's easy enough to describe it as a pressure, but what I think it is that it just input to a threatened area. And it's a type of allodynia in a way because it's a normally non-noxious stimulus, and it's a stimulus that your body can by and large ignore. But I think that just that continuous stimulus of pressure that normally doesn't even meet any kind of perception threshold is threatening just because there is stimulus coming to the threatened side. Because otherwise it can't possibly be damaging anything, right?
No, no. And
Right.
it's like I'm not even actually bearing the weight yet. It's the attempt to do so.
Oh, even the attempt is
Yeah.
painful. Okay, okay.
Actually, I didn't even tell you this, but like the first day it happened, or the first days when it happened, even like trying to lift my head up off the ground, like it just felt like I had the world's weakest sternocleidomastoids and stuff like deep neck flexors. Like I couldn't bring my neck up off the ground. My head felt like it weighed like a ton. And I made my fiance, because it hurt so bad, I was like, all right, just lift up my head for me, and I'll get up the rest of the way.
Oh, that's funny. Yeah, well, I mean, I think we never needed research to tell us that pain alters motor control because anyone who's ever been in pain before certainly does not ever want to do the same movement that hurts. I mean, it's
Yeah,
pretty automatic to have like a severe sharp pain with something, either when you're walking or moving your head or neck, and then to want to avoid that is pretty natural, I think. Um,
I agree.
So yeah, I mean, probably your deep cervical flexors and your capital flexors were inhibited due to the pain that you were perceiving. So I guess our primary goal today will be to restore your motion, but let me just check your motion to begin with. Other than the movements, the ISTM and everything that help, does anything else help before I even ask?
Man, I haven't been doing too much. I just kind of been the lazy man's clinician who doesn't treat himself.
Right, right, right. Okay.
Uh,
And then, and any arm movements or anything else bother you other than head and neck movements?
I mean, like putting on a shirt was bothering me, but I think it was more from trying to get my head flexed at the end to get my
Okay.
head through the hole.
All right. And oh, what kind of tight shirt are you putting on? You have to flex your head to put it on.
I gotta show off, I guess. I don't
Yeah.
know.
So, um, so What about any trunk movements, deep breath, coughing, anything like that?
The first day, deep breath did bother it, especially in that scapula area that I drew out on your map.
Yeah.
Um, that would cause some like pain there. But I know that I have terrible, trunk motion. I know that I have terrible shoulder patterns, and so those I know those are dysfunctional, non-painfuls that probably don't help at all.
Yeah, it probably doesn't help, but I mean, sometimes if that's your normal, it's easier to reset the system if you don't have as much range. Because if you could just have to get to end range of your shoulder or your thoracic spine, that might improve the mobility of your upper body, especially your thoracic spine.
Mm-hmm.
So let's just check. So can you touch your chin to your chest?
You want me to stand up, or you want me to just sit?
You can sit for now because I'll probably just do everything upper quarter.
That's what I say. That's where I stop because of pain, mostly, I think.
And you're not quite getting there.
That's like 4 fingers difference.
Yeah, yeah. And it's funny, like you have a complete lordosis. Like it doesn't even change. It's like it's not even coming from your neck. Your upper cervical is moving, but
I can just keep my this moving, all upper cervical.
yeah, yeah. Okay. Um, Now let me see how far can you turn to the left? Yeah, it's not as bad as I thought it was, as from what you said. Yeah, but it's definitely not as good.
It is
Uh,
better. I definitely agree. It is better.
DP?
No, not anymore.
Oh, so
Just
it's
feels like
DN.
if I go really hard, like try to turn really quickly, then it's DP.
Yeah, okay. Now look upward and backward as far as you can go. Anything?
DN doesn't
Yeah.
hurt.
Okay. All right. Now let me see you from the front. Do that. Yeah, you're deviating to the right, so obviously you have a lots of ability to load on the left. Can you turn around and do the shoulder patterns? And you might have to scooch back a
Yeah.
little bit so you can see your MRE.
Sorry if I cause an echo here.
That's all right. I find that like laptops compensate for that because I don't use them for the consults in case I have to move around. I only do it for podcasting. Go ahead. Oh, left arm first.
Is the view good now?
I can't hear you.
Is the view good?
Oh yeah, yeah, yeah.
All right.
Perfect. Any pain? Okay. See the right arm now? Oh, the right arm's tight in LRF and MRE. Any pain with any of those? Okay. Your left arm was better in terms of your LRF, but MRE was equally limited. Very similar to my patterns. Um, and let me see. Can I see seated thoracic rotation?
You want to see it straight ahead like this?
Yeah. Your fiance isn't around, is she?
Yeah. When we get her.
Yeah, just to overpressure your thoracic spine because you actively it doesn't look that bad, but sometimes even if there's an increased resistance to emotion, then I'm going to call that, that I'm going to say that is more dysfunctional than the other side.
1 second, I'll get her.
Okay.
All right. I have help. Which way do you, which direction do you want first? You're just gonna
Right first, and then
push me.
overpressure.
You're just gonna see if you can rotate me a little bit further. Okay.
How's it going?
Good.
Want me to do it by myself again, actively?
Yeah. Did you
All right.
notice? Did you notice any difference in resistance to one motion versus the other?
Hold on. Okay, give me overpressure again, Nicole.
Actively, it looks a little more limited to the left.
Oh yeah.
Yeah, yeah. Okay.
It also
Thank
could be
you.
close to DP too.
What's that? That was DP?
It, yeah, when in doubt, probably call it DP, right?
Yeah. Thanks a lot.
For her.
Yeah, that's it.
All right, thank you.
Okay, so if we can't get your head to move into side bending better or retraction with extension, if that doesn't clear up the motion, thoracic whips to the left may help.
hmm
All right. So let me see you retract. When you retract, how's that feel?
Just like like that pressure at the CT junction,
Yeah.
but not like a bad pressure, like the stuff that you would expect to feel.
Okay. Hold on a second. I forgot that when I share on Google Plus, it takes like 30 minutes for it to actually go through the rest of the feeds.
Oh wow.
So I'm just going to quickly post on Hootsuite, and that will get.
You know when Charlie Weingroff talks about feeling that pressure in the back of the neck with pack in the neck? That's what I feel, like a normal pressure.
Go figures. Right as I did that, then it pops up. Okay. All right. So when you retract and extend, how's that feel? Retract, hold the retraction and extend.
I mean, like no pain. It doesn't bother me to do it.
Okay. Well, it also could be because you're deviating to the right. So
Oh.
try to do the same thing and deviate to the left.
I mean, I kind of feel that pain that I talk about feeling when I try to rotate to the left if I deviate to the left.
Okay, now during the onset, do it slower. And during the onset of pain, give yourself a little light resistance, like 2 or 3 finger with resistance, to kind of do like a PNF through that motion. Do you still feel the pain?
No, not as much.
Okay, and go slower, slower, slower. Keep going, 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 keep going.
I
Good.
don't think there's any further.
Well, no, that's where I wanted you to stop. Now try about 10 of those, and we'll try having you side bend to the left again. Slower, slower. It's not a race. Good. How's it feel?
Fine, no pain.
Good.
Maybe at the extreme end range I feel it again, but it doesn't hurt.
Yeah, that's I mean, it's normal to feel a little discomfort, especially at the end range, of course. Slow down there, buddy.
Sorry.
The thing with speed is just more threatening, right? So if you slow something down, you could probably go further, and it won't be there'll be less discomfort. You're starting to slightly deviate to the right again. There you go. Good. Now go ahead and turn to the left again. That looks better. How's it
Doesn't
feel?
really. I mean, if I just slammed my neck, like something nobody would ever do, it would hurt. But now it feels all right.
Look to the right again. It's still not as good as it is to the right. Let me
Hmm.
see your side bending now. Much better.
Better.
Much better. Now let's try the same thing. So if you tuck and then side bend to the left, but you give yourself just again light pressure during the motion. See if you can go further and slow it down. You're losing the tuck though. I can see your chin. If this is 3D, I'd be dodging your chin right now. Keep tucked, buddy. Keep tucked. Try not to bend your trunk as much. Does it hurt?
I mean, it feels more like if you're pushing on a trigger point type sensation, not a real ow.
Okay.
Better.
There you go. Now try to pull yourself passively to go a bit further, and then do some PNF, like hold relax at the end to go even further. Good. Give that a little break, and then turn to the left again. Still not quite as good. Let me see you extend again.
With retraction?
No, just normally extend. You're deviating, but not nearly as much. Now, what felt more comfortable? Was it the retraction with extension or the retraction with the side bending?
Retraction with extension.
Okay, okay. Um, let's check your seated rotation again. You don't have to call your fiance in again. Let me just see if actively that looks better. Okay. Any pain with either one of those?
No.
Okay. Try some, in between, let's give your cervical spine a little break. Try some thoracic whips to the left,
Okay.
and then we'll recheck your motion again.
All right. You ever do them in a plain chair like this? Or should I just sit on my treatment table that my laptop is on?
Uh, a plain chair is okay unless you're just gonna like, I don't know how solid a chair is. Like, don't fall off the chair. Don't hit the chair, or don't hit your elbow on like the back of the chair. There you go. How's that feel?
Definitely got a lot of cavitations.
Yeah. Well, I couldn't tell if I could hear. I was hearing cavitations. Do about like five or six more,
Okay.
um, and then we'll recheck your motion. Nice. You're going a little faster. That's good. There you go. Okay.
Dizzy.
All right. Okay. That's better. Faster too, of course. Sorry. Better to the left. Now, let me see your cervical rotation to the left. Yeah, it's still not quite as good, but I mean, it's still better and it's faster, which tells me that it's less threatening.
Yeah, I don't feel anything in the scapula area. Just at I start like C7, T1 area.
Right. So that's good. I mean, the thoracic may have been referred from cervical, or might have just been actually some thoracic issues. So I think you're going to do the retraction extension again. That looked a little straighter. You're going to do the retraction extension, except for you're going to do one hand is going to apply the force through for like the PNF effect.
Mm-hmm.
So one hand at the top. like a little bit above your occiput. In the other hand, you're going to slack the skin at the area you feel the pinch superiorly to see if you can get rid of that pinch. Mm.
1 second.
Or you could do that.
Now it's warm down here, so I gotta
Oh,
get the sweat off.
so what is it today?
It's actually a cold front. It's supposed to actually get down into the 70s.
Wow, yeah, we're like, it's going to be like 40 something on Halloween today and rainy. It's going to be great.
Terrible.
Make sure to bend to the left too.
Maybe start.
A little bit more to the left. Switch hands. Sorry. Yeah, so you're giving the resistance. There you go. There you go. Now you can bend to the left because the left hand was in the way before. Keep going. Keep going. Keep going. Extend, extend, extend. You gotta let your chin come up. Let your chin come up. Not from your body. Let your chin come up. There you go. Keep going. Keep going. Keep going. Keep going. Just wiggle your nose a little bit at the end to get some end range.
Is that a real technique?
Well, yeah, I mean, it's not really wiggling your nose, but it's just small rotations like that. And wiggle, 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 just to get a little bit more. And exhale, wiggle, 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 wiggle. Good. Do about 10 of those, and then recheck rotation and extension. And let me know if you start getting that pinch. How's that feel?
Feels fine. Feels like motions I've never had.
Ha, might be true. Good.
I feel like I'm opening up stuff here, stretching stuff here that I've never stretched before.
That's possible. But in the end, I mean, it's not motion you never had, because you can't get back motion you never had that quickly. It's just motion you never accessed.
Exactly.
Okay, turn to the left. Not bad, not bad. Extend without retraction. You're still deviating, but it's not nearly as much. Now, retract and side bend. Much better. Let me see your side bending to the right.
Oh,
Your other right. It's almost as good as that. It looks pretty close, actually. Go to the left again. You're almost there. Okay, so is there something you could do now that would reproduce your pain other than these motions?
I don't think so. I probably have to go to practice.
All right. I would just say do those retraction extensions 10 times an hour or more for the rest of the day, and you should be fine.
Would you ever want me to do the extension and retractions with the mobility band?
Yeah, I mean, because you didn't have the band, that was what the right hand slacking the skin at the pinched area was.
Oh, I never used it as that. I was using it as like a P to A force.
Right. I don't even really use it to. I mean, the P to A force is also just some skin modulation, but sometimes I pull up and forward with the band. Sometimes I just kind of pull and slack the traps forward.
Okay.
Sometimes I only pull on one side. So everything looks quite a bit better. Your rotation we could also work on, but maybe in a future consult, because I want to get the extension and the side bending back, and rotation may just take care of itself. I mean, for all I know, that's all the rotation you ever had, but...
I mean, it was never anything nice. It was always a little limited.
Yeah. Well, I mean, we want to clear those things up if we can. We would tell that to the patient, too. But I think that, yeah, I mean, whether it's a band or your hand, you're always going to have your hand on you, is the thing. You're already starting to lose it a little bit, so I mean, you might have to do these till the cows come home. Seriously. Do you have any questions?
No, I don't think I focused on the extension and retraction enough, so that is probably going to be a big go-to factor, and I didn't really do my whips in the beginning either.
Right. So thoracic whips, retraction, extension. Be very, very mindful of when you're retracting and extending to stay side bent.
Yeah, that finger on this side helps a lot too.
Okay. All right,
All
we're going to
right,
start the podcast.
awesome. Thank you.
No problem. Thank you.